Welcome to the Next Gen podcast. We're having today Dr. Dennis. Doctor, can you introduce yourself for the audience, kindly?
Yes, thank you. My name is Dennis Jogovic. I'm a critical care physician from Edmonton, Canada. I work at the University of Alberta Hospital in Edmonton.
Okay, thank you so much. We are delighted to have you today, and welcome to Saudi Arabia.
Thank you. It's been a wonderful time here. Very open and very warm, and I think I've learned more being here about travel and about your country probably than you've received from me. So I think the benefit truly is more mine than for you.
Thank you so much. Welcome. So I have like general questions. My first question is, how's your daily life as critical care consultant?
Yeah, so I feel that I have a few jobs. One is being a critical care physician and consultant. In my center, we practice clinical weeks of service. So we will come on a Monday morning to work, and we will be working very hard on call, heavy hours until the following Monday. And then at that point, we will hand over care to another physician. So on the clinical weeks of being a consultant, they are very busy, many admissions, many patient care issues that need to come up. We're in a university hospital, so we have a teaching team, we have medical students, we have residents of varying levels, and then we have our critical care fellows as well. It's a very busy week, but it's also very challenging and very gratifying. When I'm not on that week of service, though, then I do many administrative roles. I'm the medical director for my intensive care unit, and I'm the medical director for our organ donation organization. So if I'm not working clinically, then I'm doing daily hours, office hours, meetings and planning and policies and taking care of those other aspects of care.
Nice. So during the day, any exercises, waking early, anything special help you to run all this?
Yeah, things are always easier when I'm not working clinically because I think you have more time, you have regular hours, you're not on call. But I think it's really important, at least for myself, to be physically active. When in Canada, certainly there are easier months in the summer and there are harder months in the winter. And once the snow melts, I like to ride my bike to work because it helps me clear my head. It gets me a little bit of exercise. It gets me to work, and then it gets me home as well. It can be a little bit more challenging in the winter when it's cold out, and truly you have to drive to work. So I lose that, but I try to have some exercise at home and challenge myself by trying to keep up with the kids and all those things as well.
Nice, managing home and family
Yes.
and work. My second question is about the residency.
Mm-hmm.
If I take you back to your own residency, what things would you do differently?
Oh, wonderful question. I had two residencies. So in Canada, we have to have a base specialty before we can start critical care medicine. So my base specialty is emergency medicine, and that was 5 years of residency training. And then after that, I did 2 years of critical care residency training. Looking back, and also the experience then is that you have to make sure that your training is truly a marathon, not a sprint.
Mm-hmm.
You can't run full blast the entire time or else you won't make it through. There will be times that you have to work harder and work faster, but then you also have to recognize there will have to be times where you slow down a bit and look after yourself, or else you won't finish that race. And I think it's easy to put your own health last, but it has to be in there. I think it has to be put forward, and you have to keep it in mind as well. Not easy to do. I recognize the challenges of residencies and education and research and presentations and preparation. There's so many things weighing on you, and there really is there's no time off. There's no off switch because you can always be doing it. So I think the thing I would say looking back is to find a way to make sure that you can do this work every day, but also to find time in that week. Maybe it's not every day, but time for yourself to make sure that you look after where you're at.
So you trying to put yourself first during the...
It's hard to do during
Yeah,
residency.
yeah.
I don't think it's easy to put yourself first. I think you just have to make sure that you remember yourself, that you don't forget who you are. Especially critical care, I found that 2 years was probably the hardest 2 years of training that I had. Very long hours, very little time away from work, very little time for all those other parts of your life, but also recognizing that it's a short-term thing and you get through stages, and then there's times where you need to catch up. But it was very difficult and very challenging.
Yeah, but it's difficult, but it's already short time, so we have to do it. The second question is about the topic that you give today on organ donation. Can you tell us about it?
Absolutely. I think organ donation is one of those things that came to me during my career. I wasn't necessarily looking to take it on, and it came to me as a sort of a door that opened, and I looked in that door and I thought I'd give it a try, and it's been one of the more rewarding parts of my career. I think in critical care we go into it because of the challenges of resuscitation and the sick patients, and then we realize later that there's very little time that we're doing resuscitation, a longer time that we're taking care of patients that are slowly getting better. We also know that there's many of our patients that do not survive. And is there a way to find some good out of that grief? And organ donation was one thing that really came as such an important place that needs attention and needs support. Again, it doesn't mean that families have to say yes. It doesn't mean that this is what we have to do, but we have to get in the practice of asking. And I think it's been a really rewarding part of my career. It's allowed me to interact with people beyond ICU, political leaders, heads of the hospital, other services and surgeons. And I've really enjoyed it. It's been a very gratifying part of my career.
Nice. Any special story that you remember from part of the organ donation that...
When I first took on the role as the medical director, I was learning a lot about what I needed to do as part of that job. And one of my first big events was that every year, the organ donation organization, we called ourselves the HOPE Program. The HOPE Program would put on a yearly event for the families of the patients that had passed away and had donated. And it was an invitation. Some families weren't ready to come to these, and some families really wanted to come. And it was an evening to celebrate what they had gone through and to celebrate their loved ones and remember them, and also give a chance for families to come together. And I had a family come up to me that evening, and they said, "You may not remember us, but you looked after our son." And I did remember their son. He had a cardiac arrest at a fairly young age, and he went on to become an organ donor. And the family came to me, so this would be 8 months later, and said that opportunity to become an organ donor of their son in such a devastating time frame had helped them recover, had helped them move forward. And they came to thank me for allowing that opportunity to be there. And it's so hard to think to yourself that a family where you failed, the patient died, and to have that family thank you for what you did as an outcome, I think is a really important thing for us to keep in mind, that sometimes we can't change the outcome, but we can change the way that family will survive that episode. So it was a very heartwarming and eye-opening event for me.
Yeah, and it's not usual to thank you. Their son has died, and
and this
he donated his.
It's
not usual, but I think they're very kind and nice family. The other question is about I want to ask about the pathway during the career. Would you think that it's come clear from the beginning, or straight,
Oh.
or you have to struggle?
I think that as you go through and you start your career, you have an idea of where you want that career to go. And like any path, it can change and it can take turns, and sometimes you get lost for a while and come back, or opportunities come up that you never thought of. Again, organ donation, being a medical leader in that area was not something I necessarily thought of, but the opportunity presented itself to me. And I had two choices. One was to say, no, thank you. And one was to say, yes, I'll try. And I would encourage all of your listeners that when those doors open, when those opportunities come up, to heavily consider saying, yes, I'll give it a try and see what you think. Because it may open something, a part of a work world that you never thought would be there. And sometimes those are the most rewarding ones.
Yeah, the unexpected thing that
Yes.
we just match with it, but it wasn't within our plan and we didn't think about it.
Definitely.
Yeah. Any advice for the residents?
My advice is that if you are in the field of critical care medicine, I truly believe you have chosen the best career in medicine. I do believe that. I've been working now for 20 years, and I am still excited every day that I go to work. Yes, there are tough days. Yes, there are challenging days, but the job challenges me. I very much appreciate the multidisciplinary perspective. I get to interact and work with so many talented people. And I really do think that we help our patients and their families. And at 20 years of work, I'm still excited to go to work. So I think that's a good sign.
Yeah.
I don't find that I'm bored. I don't find that I'm jaded. I find that I'm engaged and excited.
Was that from the beginning or later on started?
I think it's always been there. I think you fear early in your career, what will you think of your job in 10 years, right? Will the exciting stuff become boring? Will the boring stuff become too much of an anchor on you? And so I think you're always concerned, what will things be like in 10 years? And I've only been excited and supported by my work. So if you're in the field of critical care, congratulations. I do think you've chosen a very, very wise and fulfilling career.
Yeah, thank you so much. Thank you.
You're welcome.
It was a pleasure to have you. Thank you so much.
Thank you. Thank you.